Hello everyone. Today, we're exploring the medication ferrous sulfate, commonly known under brand names such as Fer-In-Sol and Slow Fe, among others. As always, this session is intended for educational purposes only. If you have specific health questions or concerns, please consult a medical professional. Description: Ferrous sulfate is an oral medication, available in tablet, liquid, and extended-release form. It belongs to a class of drugs known as iron supplements. Its primary use is to prevent and treat iron deficiency anemia. This condition arises when there's a lack of iron in the body, leading to reduced production of red blood cells. Ferrous sulfate works by replenishing iron stores in the body, helping to restore the normal function of red blood cells and improve oxygen transport. It's commonly prescribed to individuals who are at risk of iron deficiency, particularly due to poor diet, increased iron requirements during pregnancy, or bleeding. Warnings: It's important to note that ferrous sulfate should be used with caution. Overdosing can lead to iron toxicity, which is particularly dangerous in children and can be fatal. People with hemochromatosis, a condition involving excess iron accumulation, should avoid this supplement. It's also unsuitable for individuals with other types of anemia that are not caused by iron deficiency. Before taking this medicine. Before starting ferrous sulfate, tell your healthcare provider if you have allergies to any medications, particularly iron supplements. Discuss any existing conditions such as liver disease, stomach ulcers, intestinal disorders, or thalassemia. Pregnant and breastfeeding women should only use ferrous sulfate under medical supervision due to the potential risks and adjustments in dosage. Inform your doctor about any medications you are currently taking, as iron supplements can interact with other drugs, such as antacids, some antibiotics, and other supplements. Side effects: Common side effects of ferrous sulfate include gastrointestinal discomfort, such as constipation, diarrhea, nausea, and stomach cramps. In some cases, it may cause dark stools, which is generally harmless. However, if you experience severe or persistent side effects, contact your healthcare provider. Rare but serious side effects include allergic reactions, such as rash, itching, swelling, and difficulty breathing, which require immediate medical attention. Interactions: Ferrous sulfate can interact with various medications, reducing their effectiveness or increasing side effects. It's particularly known to interfere with the absorption of certain antibiotics and medications for osteoporosis. Always inform your healthcare provider about all medications and supplements you are taking to manage potential interactions effectively. Dosage: The dosage of ferrous sulfate varies depending on the age, condition being treated, and specific needs of the patient. Typically, for adults with iron deficiency anemia, the recommended dose is 325 mg, 65 mg elemental iron, taken orally 2 to 3 times a day. For children, the dosage must be determined by a pediatrician. Always follow your doctor's instructions precisely and do not adjust your dose unless advised by your healthcare provider. Avoid: When taking ferrous sulfate, it's advisable to avoid taking it along with antacids, dairy products, tea, or coffee within 2 hours of ingestion, as these can reduce iron absorption. Additionally, alcohol should be limited as it can aggravate side effects like gastrointestinal distress. FAQ: A common question about ferrous sulfate is whether it can be taken during pregnancy. Ferrous sulfate is generally safe during pregnancy when prescribed by a healthcare provider, as pregnant women often need additional iron. However, dosage and safety should always be confirmed with a healthcare provider. Closing: That concludes our overview of ferrous sulfate. Remember, the information provided is for educational purposes only and should not replace professional medical advice. If you have questions or concerns about your health, always consult a healthcare provider. Thank you for joining us today.